Hi, Early Head Start family and ECE leaders and community in general. Welcome to our fifth Early Head Start Rising Summer Webinar 2022. I am Suli Vasquez, the Associate Manager of Early Head Start Programs here at the National Head Start Association. If you joined our previous webinar 2 weeks ago, Human Superpower to Overcome Trauma with Dr. Dolene, or any other Early Head Start Summit webinars, welcome back. For those of you who are joining us for the first time, welcome. I'm glad you are here with us today. If you want to watch our previous webinars, the recording is available on our website. As you enter the Zoom room, please share in the chat your name and where you're zooming in from. Before I introduce our guest today, I want to remind you that these Early Head Start webinars are part of our Early Head Start Rising campaign. If you would like to know more about the Early Head Start campaign, please visit our website. The link is in the chat. Our webinar today is Preventing Picky Eating from First Bites with Dr. Fernando. She's a pediatrician and a founder of the website dryum.org and the Dr. Yum Project. She's the owner of Yum Pediatrics, which focuses on wellness and prevention through a healthy diet. She's also a co-author of Raising a Healthy, Happy Eater and Dr. Yum's Preschool Food Adventure. She's a fellow of the American Academy of Pediatrics. She recently presented at our National Head Start Conference in Baltimore. If you were able to attend, I hope you had the chance to go to her session, Cooking with Elaf. Dr. Fernando is a mom of 2 boys, and as you might guess, she enjoys cooking healthy meals with her family. Before I pass it to Dr. Fernando, I want to remind all the attendees that if you have questions, please put them in the chat. We will have some time to answer some questions at the end of the presentation. Hi, Dr. Fernando. Thank you for being with us today.
Hi there. It's lovely to be here with you today. I did so very much enjoy the national conference, and maybe I met some of you. If I did, maybe you can even say hi in the chat and remind me where you're from. So today I'm going to talk about preventing picky eating from first bites. And as Zuli mentioned, I'm a pediatrician, and one of my passions is really teaching families about the developmental process of feeding so they can raise great eaters. So just to give you a little idea of what we're going to talk about, I am the founder of the Dr. Yum Project. We're a nonprofit organization in Fredericksburg, Virginia. I'm going to tell you a little bit about our origin story and what programs we have available. I'm going to highlight some of the strategies to support starting solids, and I'm going to talk about some resources that you can access so that you can know how to raise healthy, happy eaters. One of them includes my book. All of the proceeds of that book go to the Dr. Yum Project. I'm going to tell you about a campaign that the Dr. Yum Project participates called Veggies Early and Often. And then I'm hoping we'll have some time at the end so I can give you a tour of our website, because there's a ton of free resources on our website as well. So the reason I got started in this particular, field of interest is because I was seeing so many diet-related illnesses. Of course, we all know that obesity has been a rising problem in pediatrics. And of course, during the pandemic, there was a huge spotlight and acceleration of pediatric obesity rates. But I really started to get interested in this connection between diet and illness because I was seeing so many symptoms of diet-related illness in kids that were not necessarily overweight or obese. There were many digestive issues, even urinary tract issues related to digestive issues, musculoskeletal issues, behavioral and learning issues. And when I spent a lot of time really figuring out what my patients were eating, there was often a direct or indirect connection between these symptoms and diet. So I set off on a path to come up with some solutions. And I first started back in 2011 to 2013, just handing out recipes. These were mostly family recipes. At the time, my children were really small. And so I was trying to raise healthy, happy eaters as well. And we put a lot of our family recipes on a website. And that was a place I could send patients to try healthy whole foods with their families and their children. And I would share with them that my kids were learning to eat these foods too, and kids can really learn to eat foods that were more healthy and whole than the standard American kid-friendly diet. So that really started to gain some traction, and families were really paying attention and making more recipes, and their kids were starting to learn to eat good food. That got me really energized. And so I started to look at other ways to do hands-on cooking instruction and hands-on ways to let families know how to raise great eaters. So I developed a cooking curriculum for older children to come into a kitchen in our community that we would borrow at one of our local churches and teach kids how to use fresh Virginia produce. We're in Fredericksburg, Virginia, where we have a lot of local foods. And so we would cook with the kids, and we realized these kids really enjoyed it and they were eating the foods they prepared. That started me thinking about this younger age group of preschoolers. And we happen to have a very high rate of obesity amongst preschoolers on the WIC program, the highest in the nation. So we set out to create a curriculum for those young children in schools. What we realize is we can't really just teach kids how to eat better in a vacuum. We have to really teach the family how to do that. And then we have to have support within schools in their communities so that raising a healthy, happy eater is easier. So our mission at the Dr. Yum Project is to help families and communities overcome barriers to eating well. And our vision really is that eating well is a prescription for a healthy community, a healthy family, healthy community, and a healthy world. The 4 core programs we have at the Dr. Yum Project include our cooking school. So I'll show you some pictures of our brick and mortar teaching kitchen and garden, where we teach a lot of classes. And of course, during the pandemic, we weren't able to do a lot of hands-on cooking instruction. So we do have some virtual programs as well. We also have our website, which I'll tour you through. And then we have a program for physicians who are interested in using our resources to help their own patients in their own communities. And our preschool food adventure, which I'll tell you a little bit about at the end as well. So back in 2014, when some of these programs in the Dr. Yum Project were really starting to get formed into this nonprofit, I decided that I would actually quit my job where I had been practicing for many years and start my own practice so that I could house a teaching kitchen and share it with the Dr. Yum Project. And so my patients or any members of the community who wanted to use the kitchen, particularly with other nonprofit partners, could come to this space and enjoy it. So I opened Yum Pediatrics, which is my private practice, but we shared this beautiful teaching kitchen where a lot of fun and great food happens on a regular basis. We also surrounded the building with an edible garden so that kids of all ages can come and learn to eat good food. And a lot of my own private practice patients tell me that their kids really learn to love food from coming to their well visits and visiting the garden and trying some of these foods over and over. So one of the other problems that I'm seeing a lot of in pediatrics is this emerging issue of picky eating. And picky eating can go all the way from garden variety picky eating, which can be a normal phase for children in their feeding development, all the way to full-blown feeding disorders that require serious intervention and help from perhaps even a feeding team. And there's also this issue of anxiety. Anxiety is something we're seeing a whole lot of in pediatrics these days. And there can be a lot of overlap between this issue of picky eating and feeding disorders and anxiety. And so that's important to acknowledge because sometimes we really have to use specific strategies that keep the anxiety in mind if we're going to help these kids learn to be better eaters. So back in 2013, I wrote a preschool curriculum with my friend, Melanie Potok, who is a speech language pathologist who specializes in feeding issues in children. And she has particular expertise in helping kids with challenges around feeding. We both noticed how many picky eaters we were seeing in our respective practices. And so after writing our preschool nutrition adventure, we decided to write Raising a Healthy, Happy Eater, which is really a guidebook for families to use to understand that feeding is a developmental process. And I think this is a different paradigm than most people really realize. Feeding is its own developmental process made up of other developmental skills. And if we think about feeding as a developmental process, then we can really start to understand how we can be proactive, just like we do things to make sure that our babies learn to speak or learn to walk. We can be proactive with that feeding development and help them learn to be good eaters. So we wrote this to help families with that. And we also wanted to give parents a good toolbox of parenting skills. So these are our parenting passport stamps, we call them, through our adventure. You can visit these areas of parenting, and we weave these through to help families really start to hone in on these skills and use them in the kitchen around the dinner table, but also they're great parenting skills, parenting bravely, passionately, joyfully, consistently, mindfully, and proactively. These are great skills to learn in all areas of parenting as well. So we wrote Raising a Healthy, Happy Eater in 2015, but we actually updated it, and the second edition was just released in March of this year, and you can find it just about everywhere. I make sure in my community that all of our libraries have copies of it so that families can check it out if they can't purchase it, and we have it available in my office as well. Again, all the proceeds go back into our work at the Dr. Young Project. One of the things we focused on a lot in the second edition is just acknowledgement of the barriers to raising a healthy, happy eater. And in many families, we experience some of these barriers, but for some families, the barriers may be many more fold. And so it's important to acknowledge, I think, that raising children is very hard. And when we think about raising a great eater, it's important to, have resources, and not all of us have the same amount of resources, and we may have disproportionate barriers. So we spend a chapter talking about those barriers so that families can start to take the baby steps to navigate little by little, depending on where they are. I also wanted to mention that the Dr. Young Project is a partner of the Partnership for a Healthier America. I don't know if any of you are familiar with that wonderful nonprofit organization, which grew out of Mrs. Obama's Let's Move campaign when she was First Lady. And Partnership for a Healthier America is really focused on creating a level playing field in terms of health outcomes by making food accessible to all families. And they do have a campaign called the Veggies Early and Often campaign, which we are members of. And this is a campaign that's really focused on the science and research around how we get kids to increase their vegetable consumption. We know that most children do not get the recommended servings of fruits and vegetables per day, particularly vegetables. And so they are helping in a number of arenas to increase awareness around what's the evidence on how we get kids to eat more vegetables. And they're working with pediatricians, they're working with families, and they're working with folks in the baby food industry too, to shape standards around these research principles. In time, you may be able to actually find baby food products with the Veggies Early and Often seal. So I want to walk you through some of the resources that are already available on the Dr. Young Project website. And when we go through our tour, I'll show you exactly how to get to these places. But first is our baby food toolkit. So there is an area of our website called Blogs and Stories, which has a lot of blog posts, which can be printed as handouts. And these handouts I actually use quite a bit in my own practice, I have handouts that I give for feeding at the 4-month, 6-month, 9-month, and 12-month visit. And those are readily available for anybody to download if you go to the blogs and stories section of our website. We also have a baby food webinar that is the webinar version of my live class that I typically teach in our teaching kitchen, but anybody can access that. And that is really about early feeding. So how do you start making food for your baby or feeding foods for your baby? What is the feeding development that's happening? How can we be proactive around just that initial part of time where you're starting solids with your new baby? And I encourage any of you who are interested in looking at that. We're going to be updating that as well. We're hoping in the next several months, but there's a lot of good information in that website and it is free. So in time, we're going to be working with a group I'm working with right now through the Partnership for a Healthier America to take the handouts from the Dr. Young Project and really update them and add some really actionable activities that families can do around feeding development. And so I wanted to walk you through what I talk about at 4 months and what developmental activities you can be doing at home with babies around feeding development to make sure that they are following that feeding development. So we'll start with the 4-month visit. So typically I start with just dispelling myths about solid foods, because a generation or even a half generation ago, the information that was given to families about how to start solid foods was a little bit different than now. So typically now we start solid foods at about 6 months, but even the information I got when my teenagers were babies was a little bit different. It was recommended that we start, let's say, with rice cereal, and then we start at 4 months. Some families were given information about putting food in the bottle. And so I like to talk before all of that happens to parents so that they know what the current information is about starting solids. I also tell them that when you're starting solids, we're going to do a lot of variety, lots of tastes of lots of little foods in rapid sequence so that kids who are now in their feeding window, their taste window, are able to get as many tastes of as many foods as possible because they're very open to tasting food at this age. We also talk about heavy metal contaminants. So families may have seen in the news that there are contaminants like mercury and arsenic. And so I try to assure parents that if they're doing small volumes of a variety of foods, that they minimize the chance of overdoing any particular heavy metal contaminant. We also start to introduce the topic of meals in parallel. So that is the idea that families can be sharing meals with their babies at the same time, the same types of meals made with a slight modification so that their babies can enjoy the same flavors, including the same spices. And I know a lot of families of all demographics, of all backgrounds, are really interested these days in making their own food. And so I want to tell parents early that that is a great thing to consider and that they don't have to have any special expensive baby making food. They probably have everything they need in their own household to make that kind of food and share meals with their babies. So the section that we're going to be including in our new handouts with the developmental activities is called Inspiring Your Future Foodie. And here's an example of what might be on those new handouts, which hopefully will come out in October. So in Inspiring Your Future Foodie, we talk about oral motor skills, gross motor skills, fine motor skills, cognitive skills, and taste training. And so when we're talking about the 4-month visit, some activities, I'm going to read them for you. The activities that families could be doing include offering a variety of safe teethers in many different shapes, encouraging baby to roll without a lot of supervised tummy time, encouraging baby to grab onto teethers or other safe toys, talking to your baby face-to-face, pausing occasionally to watch and respond to their attempts to communicate back to you, and make sure to put tastes of veggies on a frequent rotation once you start feeding solids regularly at around 6 months. Here's an example of how easy it can be to share food with your baby. And I included in this particular handout which foods you can steam, which foods you can serve fresh, and which can be roasted. And then the things that you need to make your baby food at home really is just, as I said, things you've got already: a baking sheet, something to blend with. It can be a stick blender, it can be a mini food processor or a blender, or NutriBullet, and then a pot with a steamer, or even just a pot with a lid so that food can be steamed and made a little bit softer. All right, I'm going to move on to the 6-month visit. Some things that I talk about at the 6-month visit include a lot of guidance on oral hygiene. So at our office, I actually give every baby a toothbrush, and we talk about the importance of starting with fluoride toothpaste. I give them a handout called Dr. Yum's No Cavity Club, which talks about how they're going to take care of their baby's teeth, because you can't have a great eater if they don't have a healthy mouth. And we talk about weaning the bottle and lots of different topics around oral hygiene. I also talk a lot about advancing texture at this age. Remember, feeding is a developmental process, and part of the development is learning how to chew and swallow texture. So at 6 months, we may be starting with purees, but there is a lot of interest in this idea of baby-led weaning too, which is introducing texture even from first bites. And I do think that, especially after a short introduction to purees, that kids should really start to learn how to chew and swallow more texture. What I have observed, though, is that sometimes families get a little bit nervous about this because they see their babies gagging a little bit. And that can be a little bit scary if parents don't understand the difference between choking and gagging. So gagging is really just elevation of the palate when texture is sensed, and understanding how to move that texture along. Are we pushing it forward? Are we pushing it backwards? And so there may be a temporary gag. Choking is really a baby is turning blue and there's no sound because there is a complete obstruction of the airway. So it's important for families to recognize that choking is dangerous, and always we want to supervise our babies. Gagging may be part of the learning process initially, and when to know when it's too much gagging. I also talk about the pace of introduction of foods, because previous advice a generation or half generation ago is that you should give your babies one food and then wait a certain amount of days before they start another food. And for low allergen foods, which we consider most fruits and vegetables are low allergen foods, we are simply delaying that flavor training that we know that babies are ready for when we take too much time between foods. So I tell families you can go as fast as possible. Again, variety, not volume. So we don't want to interrupt or decrease the amount of milk feedings babies are getting, but we do want them to try lots of different flavors. And they can introduce even a few new flavors on one particular day. It is also important that when we introduce a flavor that we sense a baby may not like, maybe they make a yucky face or they're not smiling, they're not leaning in, that we put those foods on repeat. So the research shows that it may take 10 to 15 or more tries. So I tell families, if you find that your baby doesn't like peas, you put peas on repeat until they like them, because it will take many tries for them to get used to that bitter flavor. Which brings me to the point of many foods that we find, commercially available foods, are vegetable fruit blends. And those vegetable flavors, often which are bitter and take a while to learn, may be masked by a lot of sweet fruit flavors. So when we are training our babies, we really want to introduce those vegetable flavors, if possible, in their more pure form, so that babies get used to those vegetable flavors and that bitterness that's unique to those flavors on their own. And that's really what happens when you share meals with families. We're not making a baby food version of a vegetable, we're sharing the same kinds of vegetables that the whole family is eating. Another new concept is the idea of introducing high allergen foods by 12 months, which wasn't the common feeding practice even a decade ago. So we want to let families know that these high allergen foods are ones that we really want families to expose their children to, as many as possible, by 12 months, and to continue to offer them at least 2 or 3 times a week so that their babies have less of a chance of developing food allergies. And then I encourage introducing water for taste, about 4 ounces, no more than 4 to 8 ounces a day in an open cup or with a straw cup. We like straw cups a lot because as opposed to a sippy cup, which is just really designed to keep your carpet clean, a straw cup actually offers a lot of muscle work for the oral motor muscles that are important in learning to eat and also important in learning to speak. So those muscles end up getting a lot of nice work when babies use a straw cup as their primary cup. These are the top 9 food allergens. This past year, sesame was added to the list as well, so that families now should be able to identify on nutrition labeling if sesame is included so they can avoid those products. In terms of developmental activities, for 6 months, provide a variety of purees that they can suck from a spoon or fingers and small squishable pieces of finger food. Position babies for feeding with support around the back and sides and under the feet. This is really important because a lot of babies are kind of sloshing around in a feeding chair because they're so small, and they're working really hard with their core muscles, and they don't have their feet to ground and support them. So it's really important to put some padding around the back and side so that babies feel stable. They're leaning a little bit over their tray, and that there's something under their feet to kind of steady them as well. In terms of fine motor skills, provide soft pieces of food to help them start to rake foods with their hands and hold larger strips in their fists. They may not have a very, very mature pincer grasp now, but we can be working to get there by 12 months. Describe the foods you're eating and show them how you also eat and enjoy food. This will tie into sharing meals, of course. Offer different preparations of veggies. Boiling, blanching, steaming, roasting, and adding different spices can make many exposures it takes to like vegetables more fun and more interesting. All right, so 9 months, let's move on to that. So at 9 months, I talk a lot about chewing food with texture. It is important to note that if a baby is not getting past purees, that there could be a problem with feeding development. At 9 months, we really want babies to be chewing a lot of food with texture, picking up foods and feeding themselves. Now, there are a lot of commercially available baby foods in pouches, which can be a convenient way to introduce foods. But by 9 months, we really want to be limiting those pouches because we want babies to be chewing food, not slurping food. We want them to be using their oral motor skills and working to chew their food. The other thing about pouches that's interesting is that back to the idea of flavor training, a lot of pouches do have blends that may include vegetables, but many times those vegetables are very much masked by fruit flavors. And so we also want to be mindful that we try to offer those pure vegetable flavors, especially when we're doing initial flavor training. In my 9-month handout, I also include a lot of finger food ideas. There are a lot of finger foods available at the grocery store for babies and toddlers, but the American Academy of Pediatrics did a study and found that many of them may have too much salt or sugar. So the yogurt melts, the little puffs, the little cheese curls and things that are made for babies and toddlers could have a lot more salt and sugar than babies need. So I offer a lot of ideas for finger foods that are really just whole foods that the family might be eating diced into soft and safe shapes and pieces for babies to pick up and feed themselves. And then again, I want them to be learning how, usually at the 6 to 9 month, they can be learning how to use a straw cup so that they're ready to get rid of their bottle at 12 months, which is better for their oral health. So in terms of developmental activities, we have a number of developmental activities that they can do. You can train your baby on a straw cup to strengthen muscles of feeding and speech, strengthening leg, arm, and core muscles with floor play will help them to feel stable as they sit in a feeding chair. Pieces of soft food in an ice cube tray can help guide the pincer grasp. So they're really kind of forced to get those fingers together when you put something at the bottom of a well of an ice cube tray. Teaching your baby a few signs can reduce frustrations that babies can have around mealtime until their expressive language begins to catch up. So a few little signs can really reduce frustration, especially more sign. And then we want to continue to offer parallel meals to the family meals so the baby can get used to the ways that you season food and to help reduce the need to prepare multiple meals because nobody has time to make different meals for different members of the family. All right, so on to toddlers. I just wanted to start by saying that 50% of parents of 2-year-olds report picky eating behaviors. So the first year of life is fairly straightforward because babies are really growing quite fast. And then they stop that really rapid growth acceleration. And so there's a lot of perceived picky eating. And families might notice inadequate dietary variety, eating the same foods repeatedly, and an unwillingness to try new or familiar foods. And a lot of this perceived pickiness is really a reflection of the fact that a toddler's body does not need nearly as many calories as an infant's body. So infants will pretty much eat anything, even if it doesn't give them the most happy face. They usually lean in and want more. So their body is craving calories and energy to fuel that growth. But if you look at the growth curve of a toddler, it's quite flat, and their metabolism is also quite a bit lower. So they really, I always tell families, toddlers really only eat 1 or 2 good meals a day. And we want to make sure that we're offering a good variety of foods, but that we don't have to necessarily become a short order cook and only make the foods that they like. So this is a great time to start exercising the concept of division of responsibility. Division of responsibility is a concept by the famous dietitian Ellen Satter, and it's really outlining what a parent and child's roles are when it comes to mealtime. So a parent decides what to eat, when to eat, and where to eat. So we're eating chicken, broccoli, brown rice, and strawberries. We're going to eat at the dinner table, and we're going to eat at 6 o'clock. That's the parent's role. The child's role is to decide whether they're going to eat and how much they're going to eat. If we can keep these two roles separate, and parents aren't trying to decide if the child is going to eat, and the child isn't trying to decide what they're going to eat, it makes this parenting job through especially these challenging toddler years a lot easier. And this is the best time to start really practicing this parenting principle because toddlers are very challenging and they're not that interested in food. So if we can just rely on the idea that their bodies know just how much they need to eat to grow, we offer the food and we let them decide if they're hungry enough to eat it. It really goes much better. We also can do our part to help them to develop some hunger. So I see a lot of toddlers sort of grazing throughout the day and being offered a lot of in-between meal and snack eating. And that often will disturb hunger. And hunger is what drives these toddlers to try these healthier foods and to be willing to eat some of these healthier choices. And so we want to make sure that we're leaving time for hunger to develop. So in Raising a Healthy, Happy Eater, we have this feeding schedule where we outline how much time needs to happen between morning time feeding, morning snack, lunchtime feeding, afternoon snack, and dinner time. And we call these in-between times growing times. So these are times when we are not eating, we're giving our mouth a break, we're giving our teeth a break, and we're working on growing either by resting, or we're growing by learning developmental skills, and we're not eating. And it's important to take those breaks. And while we're doing those things, we're developing hunger so that mealtime is a little bit more proactive, and kids are a little bit more willing to try. So I put a few signs when a child might be developing a feeding disorder. There's a lot more information about this on the Dr. Young website, but I will just go through a few of them. For infants, a sign that there could be a feeding disorder might be excessive gagging, an inability to advance past purees, not initiating self-feeding, or a baby not growing. For toddlers, you may see very, very limited food choices, acting out at mealtime, or failure to thrive, or not growing. And then for children, you might see an avoidance of food, limited or specific food choices. So not just that they will only eat chicken nuggets, but they'll only eat a specific brand of chicken nuggets. And because they are so limited, they may not be able to engage in activities with foods. And some of these kids may be underweight because they are not taking in enough calories, but some of the choices of picky eaters might actually be very high density, calorically dense foods that are easy to overeat. So some of these kids may end up being overweight as well. So when families tell me that they're concerned about feeding, I like to get a good history. I have a little form on the Dr. Young Project website that they can fill out, and it gives me an idea of their family mealtime experience. And then I have families write down what children are eating for about 5 days, just to give me a snapshot. And then I have them actually take a snapshot. I have them take pictures with their phone of the meals that they're serving, just so I can see what the portion size looks like and what the proportions are that they're feeding their children. I often find that with toddlers, parents are really over serving their kids and offering very overwhelming portions, and that might increase the distress of children feeling overwhelmed and having to eat food that they can't finish. And so this can be really helpful. If families want to access this, they can actually use it and take it to their own pediatricians, write down a little journal, and I'm sure their pediatricians would be happy to get that kind of a real snapshot of what's going on. So I'm going to also talk about the idea of how we can prevent picky eating by a family approach to vegetable intake. So the percentage of US children who eat the recommended servings of veggies per day is 10%. But the percentage of adults who eat the recommended servings of vegetables per day is 9.4%. So we can see there might be a connection here. We want to make sure that the feeding environment, the mealtime environment, is really one that is conducive to eating healthy, and that may mean improving the whole family's eating patterns. So some of these studies actually come from the white paper I mentioned earlier. That's part of the PHA's Veggies Early and Often campaign. And they highlight how important it is for families to share meals. So in one study, it was found that 2 to 5-year-olds children's liking for vegetables and their vegetable consumption was predicted by eating approximately the same food as parents. And this is a concept we love at the Dr. Young Project, is that meal sharing those meals in parallel with families, between families and new eaters. Another small study found that repeated exposure to commercial baby foods did not generalize to the homemade versions of the same food. Again, jarred peas may not really taste the same as the way that you season and prepare peas for the rest of the family. So we do like kids to really get onto those family meals as soon as possible so they can learn to eat the same food that they will be eating soon with their families. The other important thing is modeling healthy eating habits. We found when mothers model healthy eating at 1 year, there was a higher frequency of vegetable consumptions at 2 years for children. Not to put all the pressures on moms, we do think it's important for really all the adults in the family to be modeling healthy eating. It happened that this study looked at mothers' eating habits. And then we know the importance also at the Dr. Young Project of cooking with kids. This is a huge, important strategy to bring kids into the family meal time, starting with meal preparation. And this can happen much earlier, I think, than families realize. There are so many important developmental activities that can come through cooking with kids. Our particular experience comes from our preschool food adventure, Dr. Young's preschool food adventure, which is the curriculum that I wrote with Melanie Potok back in 2013. This is the curriculum in its current version. It's gone through many iterations and many updates to make it better based on a lot of input from teachers who've taught the curriculum, a lot of parents, and our expert team. So our core team that works on this program is myself, Coach Mel, who's a feeding specialist, our registered dietitian, Sarah Moran, and Mrs. Cannon, one of our early childhood educators, who's our preschool curriculum creative developer. And this team has worked hard to take all of this information and create edits and updates to our curriculum. I mentioned that it's research backed. So what we found is that when we implemented this program and we looked at feeding patterns in about 400 students at the beginning of the year, and then after 9 cooking experiences, monthly cooking experiences throughout the school year, that there was a statistically significant improvement in eating behaviors, particularly picky eating. So children, and you can see what the questions are that we asked, but in short, children were more interested in food after cooking. They were more likely to try new foods. They were less likely to refuse foods. They really enjoyed eating. And they were more willing to try new foods that they haven't tried before. So we were excited to be able to present this research at the American Academy of Pediatrics a few years ago. Zuli mentioned too that we presented at the national conference in Baltimore recently, and we really talked about, how important cooking can be for development, and specifically the early learning outcomes framework. When we went through all of the points of the ELOF standards, we found that our lessons actually will fulfill 85% of those standards. And we looked at all the different lessons that we have in our 24 lesson curriculum. And we're really excited because as we're expanding our reach with this curriculum, we really do have a lot of early Head Start programs that are joining in the adventure as well. So the cooking curriculum is really supposed to be for 4- and 5-year-olds. And it's a 2-year curriculum, but we found when even younger kids had a year building a foundation with the curriculum, that it really did improve their willingness. We even found that when younger siblings of kids who were using the curriculum had their turn to try the curriculum in the classroom, they were already primed and ready because they had seen those recipes at home and they had heard the language that was used in the classroom at home. And they were much more willing from day one to start trying some of these foods. Here are some examples of some of the cooking developmental skills that can happen with preschool age kids, but there are versions of all of these areas of participating in cooking that can be done as early as 18 months. And we talk in Raising a Healthy, Happy Eater about all the things that an 18-month to 2-year-old can do in the kitchen to help with cooking, and building that familiarity with fruits and vegetables. It's so important in building a great relationship with healthy foods. So these are just a few examples, but it's easy to get a toddler up to, on a chair, washing with you, drying with you, spinning salad, doing lots of little things that get them excited. So Zuli, if we have 2 or 3 more minutes, I can walk everybody through a couple places on the Dr. Yum website that you can find lots of resources, including our recipe website. Do we have 2 or 3 minutes? Okay, perfect.
Yes, absolutely.
Perfect. So I'm going to stop sharing here and let me. Okay, so this is the Dr. Yum website. It's dryum.org. One place I'll start with is our blogs and stories, where I mentioned our baby food toolkit is. So we have a lot of topics. If you click on baby food, you'll see the baby food toolkit, which includes our webinar. So you can click on this to get our webinar. And then there are all kinds of blog posts about early feeding, including the ones that I use in my office. Again, we'll be updating a lot of these with Partnership for a Healthier America. This also has some recipes and videos as well. If you go back to the menu up here, this is the easiest way to navigate because there is a ton of information on this website. In terms of ways to make sharing meals and making meals easy, our recipe section has a ton of information. There are a lot of tags that can help you navigate certain topics of recipes. The one I love the most is the baby food option. So these are recipes that can be served to your youngest eaters and shared with the family. They may not look like baby food, but they're really meant to be shared with everyone, including your youngest eaters. So if you click on a recipe like our red lentil hummus, this is a baby food option. It has the methods, and then it also has a little shortcut that helps you make or modify this recipe for your baby. So maybe you're chopping it differently or blending it differently. Probably you're not going to spice it differently because we want babies to include spices in their taste training, but maybe you're adding salt for the rest of the family because we don't want babies necessarily to have a lot of salt. So if you need nutrition information, it's all there as well. Another quick place is called My Stuff. So as you're finding recipes that you love, let me go back to another tag actually really quick. This is the WIC food package. So for families who have WIC benefits, these are recipes that include 75% of the ingredients are included on the WIC food package. We also have a meal planner. So if you go to this place called My Stuff, as you're finding recipes, it saves in your browser in the saved recipes section, and then you can add them to a meal plan, and you can even use leftovers. So if I say I want to add this as a dinner recipe on Monday, I can also choose to use it as leftovers on Tuesday. I can say I want to add this fried rice on Wednesday and take it to lunch on Thursday, and I can build my calendar. And when I'm done, I can hit the saved recipe shopping list. And this really puts all the ingredients together and sorts them by department. So you can hit the grocery store and get everything you need for that week. Another place to explore is the Meal-O-Matic. And this is a great way to get fast recipes on the table without wasting ingredients. So if you hit one of these meals, these are frameworks. So this is a stir fry maker. You follow the instructions and you can pick your oil, your aromatic, you can pick a protein. You can go to your produce drawer and pick a little bit of vegetables that might be reaching their expiration. You can pick some flavors, and then you pick your topping if you want to top it with something special like chopped peanuts. You hit the button, and then you have your own customized recipe with the ingredients that you chose. and the methods. And then if you've never made a stir fry, there's a video of me making a sample stir fry so you can see what the steps look like. There is a ton more on this website, so please feel free to browse around. The last thing I'm going to show you is information on our preschool food adventure. If any of you are interested, you can see the ELOF standards. You can read about the curriculum. Like I said, we'd love to have more early Head Start kiddos joining our adventure. We do have every third Thursday an information session that you can join for free and meet our team and ask questions about our adventure, what it takes to be part of our list of early Head Start and Head Start programs. We have, I think now, programs in at least 30 states that are participating, and a few countries as well. So with that, I will turn it back over to Zuli for questions.
Thank you, Dr. Fernando, for sharing this great information and resources with our Early Head Start community today. The floor is open for questions, or if you have any comments, please unmute yourself. There is a comment in the chat about introducing foods, Dr. Fernando, like peanut butter. When do you recommend to introduce peanut butter to a little child?
Yeah, so if families have a baby that is higher risk for food allergies, perhaps they have other food allergies or family members who have food allergies, especially first-degree family members, it's recommended that you start actually even earlier than babies who are low risk. So that could be even before the 6-month mark. For most kiddos, though, we want to introduce them starting at 6 months. Those high allergen foods probably should be introduced one by one so that families can watch for any potential reactions. I do tell families to not get too concerned about those early reactions, because typically when a baby shows a first reaction to a food that they might be allergic to, it's pretty mild. So it could be vomiting, it could be a little bit of a rash. It's typically not going to be a life-threatening reaction the first time you introduce it, but to observe carefully, if possible, while the baby is awake for a few hours. With peanut, I recommend to my patients that they start with 2 teaspoons of smooth peanut butter, diluted a little bit and made a little bit thinner, and then stirred into another puree or soft food. Then I recommend giving half of the portion to a baby and observe for an hour or 2 hours. And then later in the day, if there are no reactions, to give the rest of that portion. If there are no reactions from there, then we recommend 2 to 3 times a week that babies are continuously eating that high allergen food, so their body continues to be used to that high allergy protein.
All right. There is another question about the Dr. Young project. Is it available in Arizona?
So the website is available in Arizona. I mean, anyone can access the website. The preschool nutrition curriculum can really go anywhere. And I would, if you're interested particularly in the curriculum, you can join one of our information sessions and find out how to access the curriculum. And we have, I believe we actually do already have at least one program in Arizona. I'd have to check our list, but we are expanding. So we met a lot of folks at the national conference. A lot of folks have reached out about joining the adventure. We've already had some folks start that process too. So it is available really nationwide, worldwide.
All right, thank you. Any other questions? If you have questions, please unmute yourself. Okay, there's another question. I have a child with some fine motor delays and was at one time failure to thrive. Parents feed him as he's approaching 2. He's capable of self-feeding, but they seem reluctant.
Yeah, I think what I noticed is that culturally there may be differences in how we approach feeding. And I know my family is originally from Sri Lanka, although I grew up here, and a lot of babies are fed until they're toddlers or even beyond. And so parents may not recognize that babies can feed themselves and the importance of practicing those fine motor skills and self-feeding skills. And so we may need to be a little bit patient with those families and show them how it can be. A lot of families too are reluctant to clean up all the mess that might happen when babies are feeding themselves too. And I try to encourage families to sort of let go of that and know that when babies are really feeding themselves and playing in food and making a mess, they are developing important cognitive skills, and that they're really developing an appreciation and a love for food from those early feeding and self-feeding experiences. I think if a child is really struggling to feed themselves because of limited developmental skills, then having the help of an occupational therapist or even a speech language pathologist who's trained in feeding can be really helpful for that child. But it sounds like for this child, it might be just gentle encouragement for the family and sharing with the family why it's important for that little one to start feeding himself. And maybe there's a hybrid approach at first so they can get used to it and take baby steps.
Thank you. Again, if there's any other questions, we have 1 more minute. Please share. Oh, if you have any comments you wanted to share with us, please go ahead. All right, we might have a quiet audience today, Dr. Fernando. Thank you all for attending, and thank you, Dr. Fernando, again for the presentation today. Thank you for attending this webinar. As always, I would like to invite you to take action with information you received today and share the information with your staff, colleagues, and families. I hope you all feel inspired to share these great resources and make healthy meals with your family. For more healthy meals ideas, please go to Dr. Jum's website. I believe knowledge is power when it's implemented and shared. So please help us spread the good and be the light to others. I want to thank all the members for supporting our mission. If you would like to be an NHSA member, please visit our website. The link is in the chat. This is our last webinar in English this year. Our next webinar will be in Spanish. The topic is el desarrollo del habla y del lenguaje, cómo fortalecer el apoyo de los niños bilingües en nuestro mundo actual. Speech and language development, how to strengthen support of bilingual children in the here and now, with the speech pathologist, Emily Vincent. This is our first Spanish webinar ever. I'm super, super excited about it. Please invite your staff, colleagues, families that are Spanish speakers who might be interested in attending our Spanish webinar next Wednesday, July 13th at 2 p.m. Eastern Time. For those attending live, you have the certificate link in the chat, valid for 1 PD hour. Click on the link and get your certificate for today's webinar. You also have the survey link. Please fill out. We want to hear from you and how we can better support you. All right, Early Head Start family and community, this is all for today. Please be safe. Let's keep rising together. Have a great summer. Bye-bye.